welcome the CEO of Thibodaux Regional Health System. My pleasure, not that she needs to be introduced, but to introduce Dr. Lindsay Lasseigne, neurosurgeon. So we're going to talk about some interesting, innovative, and forward-thinking type of procedures that you do. I think a lot of people, I'm making an assumption here, think that neurosurgeons mostly work on the skull, but in fact they have lots and lots of training in the spine.
Yes, good morning. It's always my privilege to talk to you in our community about spinal wellness. Neurosurgery is a very long residency, and we spend 7 years learning, and people think brain surgery, but we actually spend 70 to 80% of our time over those 7 years really learning and perfecting our spinal surgical skills. And I wanted to talk to you, if we could, about osteoporosis, which is a condition that affects people, especially as we get older.
Women, half of women.
Yeah, so as we get older, it's
osteoporosis
extremely
sometime.
common, especially with our aging population, as medical advancements allow us to live longer lives. It's actually 1 in 2 women, and people don't realize it's also a very prevalent disease in men as well. It can be 1 in 4 men as they get older too. And so there are some risk factors, and we always want to treat our health holistically. But the way that I often encounter osteoporosis is after a bad event happens. So people generally are not even aware they have it, and they do something that should not result in a fracture, like putting a turkey in the oven on Thanksgiving, or helping, even make the mattress, make the bed, something as simple as lifting the edge, and then very frequently just a ground level fall from standing.
Why don't you talk for a minute or two about some of the new procedures?
Great. In cases where patients really aren't getting out of bed, mobilizing, and are really starting to go down quickly, we have 2 procedures that I think come to mind. One has been around a while, and it's called a kyphoplasty, and it can be wonderful. It is not a surgery. I tell this to everyone. Both of these 2 procedures, you really do leave with a Band-Aid. So it's very limited invasiveness, not really a surgical procedure, just a needle. Okay, and in the kyphoplasty procedure, we really inject just a medical grade cement, almost like a toothpaste consistency, into the fracture to stabilize it and helps with pain. And it can take 8-10 minutes on general if you have a 1-level fracture. Some people do have multi-level fractures, and we can treat them all in 1 session. And it can be remarkable. People can leave home that same day feeling sometimes no pain, and if not, a significant reduction in pain.
Before home.
Yeah, before they leave. The second one that's a little bit slightly more involved, because it's 2 pokes instead of 1. So it's 2 Band-Aids. It's still leaving with a Band-Aid, still no incisions. Is called the spine jack procedure. And what I think about with that is very similar to like a car jack. Some of these fractures, the brick of bone has become so collapsed that it's like a wedge. And so we can actually come in on both sides, jack that fracture back up to a normal height, and then put the cement in.
Wow.
And what that does for patients is it combats that risk of what we call kyphosis, or forward-leaning posture. It also reduces the risk of fracturing above and below the fracture, which very, very frequently happens. So it not only helps with pain, but it helps with spinal alignment. And this can be done through a poke with a Band-Aid, which is so innovative and so wonderful for these patients who many times are elderly, cannot really have a more invasive procedure than that.
People have a fear of long, complicated surgeries, I think.
Yeah, so, in my hands, the kyphoplasty procedure takes about 10 minutes, and the spine jack, which still is less invasive, it takes 20 to 30 minutes.
That's awesome. Well, Dr. Lasseigne, thanks for being here. Thanks for your interest in the community.
Oh, it's my privilege.
Support, and how well you work with our staff in our operating rooms and other places, and for being an exceptionally well-trained young doctor with excellent skills. Thank you.
Oh, my privilege. Thank you.